Um, here is one of. Okay, I'm gonna try to further this out a bit. One of the biggest things about this construct, in terms of health insurance not working, is the fact that it doesn't actually insure health. And because of the fact that you have this construct that food has been, in many instances, separated from the concept of health, and this is societally wide, okay, pretty much. People are starting to wake up in terms of, although it's not enough, about the dangers of GMOs, although I've actually faced I think the last time I met up with a bunch of communist/socialist types, they were screaming, ranting, and I met one that was pretty vehement about the fact that GMOs were wonderful, and that all of the vaccines were wonderful as well, and that I should just, get my vaccines in essence and shut up, and in terms of all of the flu and pneumonia, and that I was full of it for considering questioning that. And my attitude is, I question everything, including myself, by the way. Which is why even here I let out the caveat that if someone could show me the full-on fixing of what I'm suggesting and can actually put that into place and show me how they're going to put that through in this country, then I might even change my mind on socialized medicine. But for now, I don't see it. So again, I want to make that clear, that when things change, I'm going to change. Okay, I'm not an immobile creature. I am constantly thinking and reevaluating. But by the same token, I see a disaster in terms of how what we have is a horribly run disease management system in this country. And what socialized medicine seems to offer is a more efficient disease management system. It's not a health care system at all. To me, if you're going to say that you are going to create a health care system for all, you need to start out by helping, not hurting, the construct of healthy eating for all. Okay? Which is why I would really say, and I'd actually recommend it as an element of the construct of getting people healthier, is, especially in terms of people that are lower socioeconomic classes, is up the amount, raise the funds that are given to people that are receiving food stamps. Help the food pantries more. Food stamps is probably about the only, to me, full-on socialized program that to me works about 99, at least 90 to 95% of the time. It works completely. Okay, it's again, I'm not. To me, it's just a little bit low in terms of how much people get. It's not quite adequate, but it's darn close. It's as good a socialized system as I've seen. In part, though, that's because people get to choose. All right, and and therefore it's a very much independent kind of minded system. It's giving people just a little bit of a hand up, as opposed to just, demanding that they follow a strict set of protocols. So, and in that ilk, I'd say, if you're going to first start to, say, fix the healthcare system, mandate that every single product be labeled for if it has genetically modified organisms in it or not, and clearly as well state what organically grown means to everyone. Put out a frickin' pamphlet on the government website as to what that means, and clearly express what it is, and don't, and encourage and do more to encourage small farmers to be able to, smaller farmers, smaller scale agricultural projects, to be able to say, yeah, I adhere to that standard, okay, and streamline the paperwork process for them to be able to get the certification so that more people can know when and where local, real, organic, non-GMO products can be found. Help them. That to me is real health care, because it's helping people be healthy by giving them a tool, a clear-cut tool to be healthy. Another enhancement would be get off and ban the concept of spike strips, as I call them, okay, on all public areas that people would otherwise be sitting on or sleeping on. I say this personally because those things there, and my husband and I have never slept on the street. They've landed my husband because they're there, and therefore he can't sit when he needs to in an ER more than once. Okay? Because he got to him, and his hernia was aggravated, and therefore he collapsed, and he needed. And really all he needed was a spot that was in the shade. So there was both, at least 2 occasions, there's been places that in theory he could have sat down and he wouldn't have needed a trip to the emergency room if those frickin' spike strips weren't there, and therefore he was allowed to sit down for 15-20 minutes. Daylight hours, might I add. We're talking, I don't remember the exact times, but they were somewhere between 10 o'clock in the morning and 4 o'clock in the afternoon. So, that's a second thing, okay? Anything that's called a publicly accessible space should be accessible to the public for usage. As long as there's not actual destruction of the property, and if there is, then fine. Prosecute people when they actually destroy property. I get that, okay? But don't prosecute them for wanting to just sleep there, or wanting to just sit there, and ban it in essence. And oh, by the way, there are actually laws against loitering as well, and that's another reason that at times my husband and I both, when we can't stand anymore, fear, justifiably, the concept of getting arrested for sitting down on a sidewalk. Okay? And yes, many times it takes us a lot of effort to get up. So, that's one element of it. Another thing is eliminate chemtrails. Stop giving people cancer and other diseases. Then stop all the pipeline projects. You're creating natural disasters. That would be another great thing. Okay? Stop the spread of dangerous pesticides. Okay? That would be another element of really health care. Okay? Which is to say, taking care of the public. Fully on revitalizing our infrastructure nationwide. The public trust, the public good. Okay? Fix all of it. And I mean, look, I think 60 to 80% of the pipes in this country in terms of water need to be replaced. Replace them all. Okay? First do that. Then allow for and then the last thing, and this might get more to it than anything in terms of a direct lineup, is that you should offer and help grant people in terms of people going to doctors. Bring back sliding scale fees. Help encourage them. Okay? Remove the frickin' insurance. It's a band-aid that doesn't frickin' work. And encourage doctors to actually have and help their patients be healthy, as opposed to encouraging them to make mistakes and therefore paying them more. That's what happens when doctors screw up surgeries. They get to go in again, and the hospital gets more money. So that's the current system of insurance. That's how it works. It's really, as I understand, no different in terms of socialized medicine. It's just you have less places to go to appeal the garbage. And oh, by the way, since the government in essence has more control over the doctors, you don't get the option of saying and realizing that a doctor is just a disaster and shredding their frickin' paperwork on you and moving on with your life to get a better doctor. And I've been misdiagnosed a bunch of times. And so that's a big thing for me. And many people have gotten that as well. And, but again, the biggest thing is that we're not all the same in terms of we don't all want or need or have useful the same methods of care. And so the health savings account makes sense. Encourage, again, as well, sliding scale fees. And give doctors bonuses for when they have patients that have been previously diagnosed as having multiple medical conditions, but are showing themselves year after year to be healthy. Give those doctors some money. If you're going to say, have a system for that. I don't know whether you want to call it a privatized award, okay, or a government benefit. Although if you're going to say in Medicare, Medicaid, the existing ones, I'd say the biggest way to flip them and help make them more beneficial is by saying to doctors with patients that have multiple medical conditions, hey, if your patient can be seen to live a longer, better quality of life, we will give you more money. And guess what? You won't necessarily even have to visit them all that often, so they won't even spend much of your time. You just have to visit them once a year. Let them, and with independent advocates, show and share with us that they've had wonderful results. Give those doctors a reward, a few of them, but at this point that are out there. Because again, right now we have a horribly run disease management system. We don't have a healthcare system. And massive changes are going to be needed to create a healthcare system. Shalom.